I think most of you know what ARC is, or what you think it is. It's obviously expanded incredibly significantly. I want to just get right to the point. One of the quotes that I loved, you said, in the innovation's the fun part, and transformation's the painful part. One of the things that you've done that I'm proud to be on the board is in 2018 we started as Future of Hospitals, but then the Future of Health. So I guess just on a scale from, so we've now done that for 8 years. On a scale from wow to frustration, how are we doing, and where's your relationship with the future of healthcare right now?
So it's a great question. When we started 2018, the idea was to get together a group of world leaders into what we envisioned as a think tank that would be setting a vision for the future of health. What would that look like, and how do we get from where we are to where we need to be? The idea was that we want to try and coordinate efforts, because if we each have a different vision of the future of health and we each go in a different direction, we're much less likely to get there. If we go through a joint journey, we might be able to make it happen earlier. So we're on that journey, and between wow and frustration, obviously there's a bit of both. There's a lot of wow, there are a lot of wow moments where you actually are witnessing some amazing development that's happening in some corner of the earth. We're trying to learn all of that and bring it together so that others could implement, but then of course the frustration is on the implementation itself, because as you know, transformation is painful. Innovation is the fun part. A lot of what we do here is the innovation, the shiny objects. You've shown a lot of shiny objects in your presentation, Steve, but how do we take those shiny objects and implement them broadly across broad healthcare systems? Not just with the champions that are convinced 100% that this is the right thing to do, but with everyone. Everyone, even those that think that this might be wrong, but still need to undergo the change. So it's on that journey we're on, and again, some days are more frustration, some others are more wow. Hopefully there'll be more wow in the future.
One of the amazing things about both Future of Health and SHIB-ARC, I mean, just to put the scale of this, we'll be meeting in Singapore for the Future of Health annual meeting with 30 or 40 literally CEOs, from global CEOs, but ARC itself literally runs innovation now for 9 or 10 sites around the world, bringing Israeli technology around the world. So maybe just, since we have a brief amount of time, it'd be great to think of maybe 1 or 2 things that's happening outside of Israel or the US that we actually could be proud or jealous of, and maybe 1 or 2 things we've exported from Sheba or Israel to one of our ARC sites.
Yeah, great. I mean, there's a lot to talk about here. First of all, I have to say that in terms of technology, of course, we're very advanced in Israel. At Sheba, the HMOs, other hospitals here in the country, we're already utilizing some advanced technologies. Again, our challenges is with wide-scale deployment. What we've seen in other places, for example, in Singapore, we've seen amazing population health initiatives. How to improve on a population level, how to not just focus on healthcare, but look at the broader scope of health. How do we bring education into view? Imagine HMOs here in Israel having to deal with not just healthcare education, but general education. And if you think about it, if a person is illiterate, there's a much lower chance that he's going to have a healthy life. So maybe healthcare's responsibility is to make sure we generally educate the public. That's not something we're seeing around the world. In Singapore, we've seen that, and we've learned a lot from that experience. We've seen other experiences in South Africa, of all places, Discovery Health, which is a huge payer, active in many, many countries, that's doing amazing things with gamification to try and work on people's health habits. So there's a lot we can learn. If we talk about specifically technology that's come out of Israel and ARC, hospital-at-home programs. ARC has a very strong hospital-at-home program, heavily based on technology. Many of the companies you're very familiar with are engaged in providing, whether it's a platform or point solutions for those hospitals-at-home programs. We've seen that take place in other countries. We've seen the same model implemented in Australia, for example, where, of course, with the huge distances they have, hospital-at-home programs are very critical. And we're seeing this happen now in Europe, in Belgium, in Germany, and some other locations. So this kind of cross-fertilization where ARC is bridging those sites and bringing the best that can be implemented elsewhere, is where we see the huge opportunity for the future of health.
You know, I love that you brought up Discovery Health, because we had the FOH thing, and they've really built their whole thing around behavioral economics. And, you know, their criticism, not really criticism, but their point is, look, as health system CEOs, you can only see people when they come to your office, when they come to your urgent care center, when they come to your ER, when they come to your hospital. We're looking at the other 98% of the time in their health, and how do you bring them together? So in my talk, I mentioned AI Doc, and I'd really love your thought, because AI Doc's an interesting company. It started out of Sheba. It's now become one of General Catalyst's most invested companies. And, you know, I used the seatbelt analogy, and it wasn't just a quip. I mean, the question becomes, given some of the things that both at Sheba you've been able to see, or AI Doc's a good example, it's in 2,000 health systems around the United States. I had my own situation where I had a solid mass in my right middle lobe that they thought was one thing, and AI Doc re-looked at it and changed the procedure. So when do we start to look and say, oh, this is nice to have, and we can put it on a slide, to, if you're not doing that, that's almost malpractice?
Yeah, I think we're getting there. To take the AI Doc analogy, you know, we've done a clinical trial at Sheba. I don't know if people here have heard about this. It was published about 2 years ago, and we've shown that after we implemented ADoc at Sheba's emergency department, we were able to decrease mortality for patients with intracranial hemorrhage, a bleed in the brain, by 30%. 30% reduction in mortality. This is huge. Thank you. This is Israeli technology. This is an algorithm that can save so many patients. Now, Steve, you've said this is in 2,000 hospitals worldwide right now. Imagine how many patients an algorithm is saving. There's no other example like this, because there's very few evidence that actually shows AI impact on a hard outcome like mortality. So when I go around the world and I talk about AI, and I give this example, I always say one thing. I say, listen, if I lived in a small town anywhere on the planet, and there's an emergency department down the street for me, which is probably where I'll be going if, you know, God forbid I had stroke, I want that emergency department to have ADoc, because I want my survival to be, you know, 30% better. So this is where we're going to your point, and I like your example with the seatbelt. I think this will be mandatory. We're going to need to see some countries take the lead and make it so, and others will follow like everything else. But I think 10 years from now, this is the reality.
So let's talk about the limits, all right? Because there's a lot of excitement. And I brought up Tilly Norwood. That's real. So let's say Tilly Norwood, MD, shows up at Sheba. She's synthetic, she's tireless, she never burns out, she's not going to complain to you. What's something you'd give her, and what would you never let her touch, and who's liable when she's wrong?
Well, I'll start with that liability. Liability is always us, right? I mean, we're not going to have an agent be liable. We won't see Tilly stand in court. So we're liable, but that makes sense, and I think that's the way it needs to be, and we need to understand that as we develop and implement those solutions and regulate them. Where would I put Tilly? I think where we see the most potential, and there's no doubt, and I haven't had anybody to say otherwise, is where the AI is not replacing a human, but actually coming into a point in the workflow where we don't have a human because we can't afford the human. And I'll give you an example, and it goes to another one of our development, a company called MIXiii, which is our mental health agent. So when somebody wants to call for an appointment for mental health, whether it's a psychologist or a psychiatrist in the public system, you get an appointment 2 or 3 months from now, right? And that's not just in Israel, that's very common everywhere. Huge waiting times for mental health. The problem is we don't really ask what's your problem, we just give you the appointment in 3 months. For many people, that's too late. Some people obviously might commit suicide the next day, not to mention 3 months. We are not able to triage those patients. We don't have the capabilities to triage these patients. To be able to triage these patients, you'll have to train thousands of mental health specialists just to do the triage, to determine who needs to see a mental health specialist today versus who can wait 3 months. This is a perfect point.
Game changer. That's a game changer.
Right, and she's not replacing anyone. Nobody can say, oh, she's taking away our jobs, because in that specific point in the process, we don't have a human because we can't afford a human. This is where we're going to see Tilly come in first.
So 2 lightning round questions in the last minute. By 2030, the most overrated thing in health AI will be blank, and the most underrated will be blank.
So overrated, I think, not very different than today. I think your example of the avatar, the patient-facing avatar, I think that's going to be huge. We're going to see a lot of that, and you know, expect this to happen very, very quickly. That's going to be a lot. There's going to be a lot of investments. You know, Hippocratic AI is just the beginning of that. I think what's underrated, I don't know if it's the most underrated, but what's underrated is how do we design the system differently to account for AI? Because right now we're thinking, okay, so we add AI here, we add AI there, we sparkle in AI in different junctions, but the system stays the same. What do we do about the design of the system and even the physical design? And I know we're short of time, but I'll share this very, very brief example because I think it's very meaningful. When you introduce ambient to the examination room, where the AI is listening to the conversation of the patient and doctor, summarizing it and entering into the EMR, that's one solution. But thinking how do we redesign the examination room is where we also need to think. And so right now at Sheba, we're changing the desks in the examination rooms, not to be rectangular, where there's one side for the doctor and another side for the patient, but to be round, because there's no keyboard and there's no screen between the patient and the doctor. So the design of the room, of course, from a patient perspective, is very, very important to the overall experience.
Last question. We talked about the revised Hippocratic Oath. If Hippocrates showed up now, do no harm, don't inappropriately touch patients is a pretty low bar. What's one line you'd add to the Hippocratic Oath, given what's going on in healthcare?
I actually give Hippocrates a lot of credit, because I think the Hippocratic Oath stands today, and I think what it really needs to show is that the humans, the physicians, are at the center of this. We are responsible. We spoke about liability. We're responsible. We need to make the final call. We'll be augmented so that we make much, much better decisions, but it's up to us. We are at the center of this. We're not there yet when AI is going to replace the humans, and then the Hippocratic Oath will have to change completely. I think that's down the line. Right now, we need to re-emphasize the importance of the human in the loop.
So, Eyal, I just want to end, and I hope we can all thank you, what you have been able to do, especially over the last couple years, to bring Israeli technology globally, but not only that, have people understand what's really happening in Israel has been just incredible. So thank you very much.